This is medication administration 4. I'll be administering a large volume IV medication and
Slowly flush the
piggyback.
IV with sterile.
I'm going to, upon entering the room, I'm going to perform hand hygiene, identify myself, identify the patient with 2 markers, ask for allergies, and explain the procedure and the therapeutic effect. First, I'm going to take the medications and verify them with the MAR. I'm checking for right dose, right time, right route, right med, right rate, right fluid, and time of duration. I'm going to open the IV tubing using sterile technique, placing the 2 ends separate. I'm going to turn the roller clamp to off. I'm going to remove the cap from the IV spike. I'm going to insert that into my large bolus, or my large volume, and I would do the same for the piggyback. I'm going to hang the bag to a line or to the pole. I'm going to squeeze the drip chamber a couple of times just to allow liquid to fill in that space about halfway full. This is so when I start to prime, I don't get any air bubbles along my tubing line. I'm going to prime the other end of the tubing. I'm going to place that tube inside the IV pump and set the settings. All right, so now I'm going to don gloves. I'm going to access the patient's IV site. I'm going to inject with normal saline. In doing that, I'm going to palpate the area to check for any filtration or occlusion or any sign of irritation. I'm going to then insert the other end of my line into the patient's IV port. And then I'm going to document the dose, the route, the time, any adverse effects